For PQRS purposes, a group is considered any tax identification number with 2 or more providers who bill to Medicare. If you have at least 2 providers, you have the option of reporting quality measures separately for each individual eligible provider or as a group. The downside of reporting as a group is that you must register and declare the reporting option you will be using. The upside may be less effort in data entry and monitoring. Consider reporting as a group if you have one of these situations. If you are a multi-specialty group where you would need to use different processes to collect data on different measures for different providers. Or if you have some providers who are very good at capturing quality measure data and others that have more difficulty meeting the reporting thresholds. In the rest of this video, we'll briefly describe each of the 4 reporting options and identify which video you should watch for more information. Option 1 is to report from your electronic health record system. If your EHR is 2014 certified, you may be able to complete a single report of quality measures that can be used both for meaningful use attestation and for PQRS. For many, this will be the easiest option, but it depends on the capabilities of your EHR. Group reporting will make it even easier as you will report the quality measures for the group as a whole rather than for each individual provider. Video number 4 provides more information and also a list of questions that you should ask your EHR vendor now. The second option is to report using measure groups. A measure group is a group of 4 to 9 individual measures that apply to the same population of patients, for example, diabetics or patients with back pain. There are 25 defined measure groups that you see here. If one of these fits your patient population, you can complete a chart review of 20 eligible patients and report on each measure in the group. You'll use a registry program, which usually costs $300 to $500 per provider. This option is not available for group reporting, so you'll need to choose 20 eligible patients and submit quality measures for each of your providers. Video 5 provides more detail. Your third choice is to report on individual measures via claims. This option is also available only at the individual provider level, not for the group as a whole. To avoid the PQRS penalty, you'll need to report on 3 measures for at least 50% of Medicare patients that are eligible for that measure. If you report on 9 measures, you can also earn a bonus payment equal to 0.5% of your 2014 Medicare allowables. There are a total of 284 measures, but not all are available for claims reporting. Video 6 provides details about how to choose and report your measures. The final choice is to report on individual measures via a registry program. You'll need to purchase a registry program, which usually runs $300 to $500 per provider. You'll prepare and submit your data after the end of the calendar year using an upload tool or web interface to manually enter the data. The registry will then submit the data to CMS on your behalf. You'll need to report on 3 measures for at least 50% of Medicare patients to avoid the penalty and 9 measures to receive the small bonus payment. If you choose to report as a group, you'll choose 3 measures and must report on at least 50% of Medicare patients eligible for that measure, regardless of which provider was seen. There's a possibility that you could select measures that are applicable to patients seen by just some of your providers and still report as a group. The group's reporting and performance scores would be based on the data for the subset of providers. Video 6 provides more detail on choosing and reporting individual measures. Here's a quick overview of the 4 options. Review the applicable video for more details on the options that you are most interested in. Each video will include requirements, pitfalls, and implementation tips. For those of you that would like additional assistance, we offer a standard consulting package that covers all Medicare Quality programs, including meaningful use, PQRS, and value-based modifiers. We'll provide detailed requirements and timelines specific to your unique situation and recommend approaches and measures that are customized for your services and size. The standard consulting practice includes a 1-hour presentation to your practice leadership and key staff. Additional consulting services can be designed around your specific needs. These might include development of a comprehensive implementation plan, customized workflows and data capture tools, or staff and provider training. Just give us a call to discuss your specific needs.